My name is Ruby and I'm from Tampa, Florida. Since the birth of my fourth child, my hips have tripled the size. I'm skinny up top, but then where my hips are, it's wide.
These are called saddlebags, and typically we inherit these from our parents.
My hips feel like jello. They're very wiggly. When I squeeze them, they move like all over the place.
Throughout my practice of being a board-certified plastic surgeon for the last 20 years, I found that fat deposits seem to run in families. So if your mom or dad has a double chin, you're likely to have a double chin. If your mom or dad has saddlebags like she has, you're likely to have saddlebags the same way. Now, hers are admittedly quite extreme. I have treated a handful of patients with similar conditions as hers, but you don't see this type of disproportionate kind of fat deposition very often.
Before my first 3 pregnancies, my body was normal. After my 4th pregnancy, I wouldn't lose weight from my thigh area, no matter how much exercising I would do.
So that's the hard part. When you develop stubborn areas of essentially inherited fat deposits, it's really hard to get rid of them. There's no way to naturally spot treat or spot reduce areas of fat. So people used to think, let's say, that if you've got fat, let's say, of your arm, and you exercise your arms a lot, that fat will go away on your arm versus, let's say, your thigh. But unfortunately, that's not true. You can diet, you can work your arms out, but even if you've got fat deposits on your arms, you may lose the fat from another part and have that fat stay there. And traditionally, what I've found is that when you do get these inherited fat deposits, they're the last areas to go if you lose weight.
I've been with my boyfriend almost 10 years. We've talked about getting married, but I can't see myself in a wedding dress because I feel so embarrassed.
That makes me sad because she is a beautiful woman. She's got some inherited fat deposits. To feel that self-conscious about your appearance to the point where you don't want to be seen in a wedding dress definitely is unfortunate. And I hope that she can find good help because this is something that is definitely treatable.
So this area really looks like just a completely separate part of you. I can feel there's a ridge.
So there are many ways that you can get rid of fat without just diet and exercise. Liposuction is the obvious option where we basically inject anesthetic fluid into the area and then we suck it out with kind of a long metal rod. That fat is definitely removed and does not technically come back. There are non-invasive ways of reducing fat as well. These include cool sculpting and sculpture. These can reduce the thickness of fat by approximately 20% according to studies. But she is not going to lose 20% of the thickness of fat in her outer thighs with a treatment like that. She'll only lose a very small amount, so these non-invasive options just are not going to work for her. You can also spot reduce fat by injections of Kybella. This is FDA approved to reduce fat from the double chin area. But once again, like sculpture and cool sculpting, the amount of change you get with the injections is fairly modest. So in this situation, her best option really is liposuction.
What we're gonna do is liposuction the fat out of both of these sides, wait for you to heal a little bit and continue in another surgery where I remove the skin.
So this operation can be done all in one surgery or you can split it up in 2 depending on the surgeon and the patient's preference. If you do it all in one surgery, you can remove a lot of fat all at one time. That is going to leave you with some excess skin. You can then either cut that skin out at the time of the operation or you can leave it and see how much of it kind of tightens up or retracts on its own. Then you could potentially come back in a second operation to remove that skin, but removal of the skin will give her a pretty lengthy scar in her upper thigh area.
She has a large volume of fat, and I may not be able to remove all of that fat out of there in one procedure. There's a law here in Florida that says that I cannot take out more than 4 liters of fat in a day.
So how much is 4 liters of fat? Well, it's basically 2 liters of soda pop, and you know how big those are. Now, if all she does is treat her outer thighs, my guess is 4 liters should be sufficient to get a pretty darn good result from this patient. In general, the FDA limits removal of fat to about 5 liters in one operative session. If you're going to remove more than 5 liters at one time, then you need to have blood products available and/or have it done at a hospital type of a setting. And this is because you can lose a lot of blood with removal of that much liposuction, and you can get fluid shifts from removal of that much tissue as well.
I'm gonna give you the numbing medicine, okay? Don't be scared.
Oh.
Honey, I haven't even started.
Now, this is where I would do things very differently than this good doctor. I would 100% perform this operation under a general anesthetic. And that way the patient falls asleep before the operation starts and wakes up after it's done. And I don't have to worry that I'm hurting the patient throughout the process. Now, the positive of doing it under a general anesthetic is that she won't feel any pain throughout the procedure. The negative is she's going to have a bit of a hangover effect of the medication afterwards. And there's also the risk of anesthetic-related complications as well. But she appears to be pretty young and healthy, so I don't see a reason why, in general, a general anesthetic should not be used for her.
We're gonna go ahead now and infiltrate the numbing agent, and you'll feel the little cannula go in.
Sorry, I'm
No, you're
scared.
fine.
So the problem with doing this under a local anesthetic is that she's going to feel every bit of this numbing medicine going into her. And when you're talking about two huge areas on each side of her thighs, that's a massive amount to numb up. And this involves taking a long blunt cannula, which is kind of like a really, really big needle that's kind of rounded on the end, and then essentially pushing it through your tissues while you inject the fluid. That area is only numb after the medication goes in, but in order to get the cannula into that area, there's no medicine there, so she's gonna feel it. So this is not gonna be fun for her at all. And that's why, once again, I go with the general.
You're okay.
If I can't get her to relax, she could have an issue with bleeding, she could get a rapid heart rate.
So why are they tapping her and kind of lightly slapping her? Well, one of the ways that you can actually reduce the amount of pain that you're feeling from either an injection or a medical procedure is that you can stimulate the nerves on another part of the body. You can essentially confuse your nerves so that you're not feeling it as much. And so whenever we do, let's say, facial injections, some people ask to put vibration, these little vibrating wands next to the area that you're injecting, that can make it hurt less. Sometimes you may find that if you're getting an injection, let's say for a flu shot or a vaccine, that the doctor or the nurse may kind of slap or rub the tissue, the skin, right around it. And once again, that also can confuse those nerves to make it hurt less. This is a little tip if you've got little kids who are getting shots.
The tapping method was developed out of something that I saw practitioners who put in fillers and Botox use.
So she's got a bunch of people in the operating room who are slapping and tapping this patient just to try to make it easier for her. So I don't understand, like, why not just do it under a general or at least under a sedation? The other option, if the patient says, look, I don't want to be asleep for it, is you can get an anesthesiologist or a nurse anesthetist and give a certain amount of sedative to make the patient a bit more comfortable. That can be combined with the injection of the anesthetic to make it easier than if she's just completely wide awake.
The fat cells are like caviar. The cells will just pop and turn into oil that you just suction out. And then the vacuum takes that fat away.
There are a couple of different ways that you can do liposuction. The most common way is this type, which is like tumescent liposuction, where you inject the anesthetic fluid and then you physically disrupt those fat cells and suck them out. Another way to do it is the Vaser. The Vaser uses ultrasound energy to melt the fat prior to sucking the fat out. That may be helpful in people who have a bunch of scar tissue in the area, or maybe if they have really fibrous fat. Laser liposuction is another way to do it, kind of similar to ultrasonic liposuction, but you take a laser handpiece and you actually put that underneath the skin, and the idea is that you may be able to get a little bit of skin tightening with it. The most common type of laser liposuction is smart lipo, and there's a question of whether it really honestly does much of anything different.
This is the big reveal.
Oh my goodness. It looks good. Wow.
That's gonna look so cute.
She looks fantastic. And you know, it looks like the skin of her outer thighs really retracted pretty well because I'm not seeing scars from any type of skin removal. So she was very, very fortunate there. Now, after the surgery, typically my patients who have liposuction like this need to wear a compression garment for at least 3 weeks afterwards, because that will help to reduce the swelling and to help that skin to retract a little bit better. And what she's probably gonna notice is that when she had a lot of fat in those areas, the skin was nice and smooth. Once you take that fat out, you're gonna see a little more irregularity and unevenness, and even look a little more kind of cellulite-like afterwards. And that is a trade-off whenever you do a lot of liposuction in an area like this.
Having my hips fixed is like life-changing for me. I could literally wear anything and not worry about covering up, not worrying about hiding.
So even though I would do this very differently than the good doctor did, you got to give her props that she got a fantastic result for this beautiful young woman. Now, if you think that this was an extreme operation to have done while you're awake, you got to check out this video right up here where a woman had a ton of excess skin from her tummy removed while she was completely awake, and my reaction to it. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.